All right, folks. A very good evening to one and all present here. Thank you so much for joining. We have many more people joining us, and late evening. Greetings from Rotary 3190 COVID War Room. We are very happy to have you all with us. We know the kind of circumstances that we are all going through. It's very important that we equip ourselves with the right kind of knowledge to deal with adversity. And we've been seeing acute shortage of beds. So we are trying to help people get beds. We don't have the direct link with BBMP, but we do follow the right process so that the escalations can be done and we can help the people secure the bed at the earliest as soon as it's available with BBMP. So we have a few of the experts who've been working on the front line on this, and we've also managed to come up with a portal which helps us streamline the entire process. We have a website and a portal for vendor data validation and verification. So you can go through that if you haven't gone through it yet. We'll be sharing the links of all that after this program. So today the focus will primarily be on getting volunteers who are committed, who can help us out with the calls that goes to the attenders as well as BBMP to secure beds for people who are really looking for it and they're desperate to get it. Now, I would like to request our DRR Rotractor Rajwamshi to say a few words before we start this program. We'll be having the first section, which will be the knowledge transfer session, the orientation on how, as volunteers, we can help with this entire process. And Rotractor Rotarian Vivian and Thomas sir will be leading us through that. And after this, we have a young doctor with us, Dr. Akshata, who will be uh, taking few questions, and she has prepared the most commonly asked questions with respect to COVID that she has come across, and she'll be taking us through that session so that we're all a little more knowledgeable with respect to the current situation that we are currently in. Okay, so Raj, over to you before we start.
Thank you, Krishna, and good evening, everyone. Thank you for joining on such a short notice for this training and understanding how we can be part of the COVID war room and try to help people in these situations. And thank you, Dr. Akshata ma'am, for joining. So hope you all make the best use of it. And there are a lot of people who are asking me, Raj, how can we be a part and how can we help during these tough times? This is the right way. And please try to understand the process and do join us so that we can help more and more people and create an impact. Uh, Thank you, and over to you, Krishna.
Thanks a lot, Raj. All right. So, Vivian, if you're ready, basically, we started this entire effort 3 weeks back, and we've been able to help a lot of people secure beds in multiple ways. We've been helping people, whether it's as simple as getting connected with the ambulance at the right time, saving life through that. Helping people emotionally through, during these testing times, or anything for that matter. And the kind of resources that we've built, the database that has been prepared by Rotractor Abhinav was amazing, and it has helped a lot of people. The website that has been built by Rotractor Arun Teja, the portal that has been two of the portals. One is for the patient management that will be extremely useful and live from tomorrow, as well as the portal for vendor validation. So all these resources have been extremely useful. As I said earlier, we'll be sharing those links and you can make use of it. Now I would request Rotractor Rotarian Vivian to kindly take us through this quick session where there is a list of questions and answers that are commonly in front of volunteers on how to handle a specific scenario. Rotractor Rotarian Vivian, Thomas sir, and Pallavi ma'am have been in the front line with many more volunteers to tackle all sorts of cases that have been coming our way, and uh, just taking 1 or 2 hours break on a regular basis in a day, they've managed to help so many people. So with that kind of knowledge and the experience, today I request Vivian to lead this session. And please make sure that you make mental note or write it down somewhere, because for you to be eligible to volunteer, there will be a test given to you, and you'll have to get more than 70% to be eligible to assist, because we are playing, we can't play with lives. We should be knowledgeable, and we should be able to take the right decisions at the right time. One wrong move can result in someone getting support at a later stage, and it might result fatal, right? So with that, Vivian, over to you.
Yes, thank you so much, Krishnarjun. Uh, Good evening to one and all present here. But don't get worried by what Krishnarjun said about the test. It is, we can also say it's a survey in assessing how much you have understood out of the data that you have got. So then, like he said, it is lives we are helping out, and we wouldn't want to make a mistake with it. And all information we'll be sharing now would be with the experience that we have had for the past, I think, over 2 weeks that we've been handling cases with the BBMP and helping beds get allotted. So, can we have the questions, please?
Abhi, can you share the screen?
Even the document is in the core team, so you can just like read out. I mean, instead of sharing, I mean, it will be someone ask the questions and one can answer it.
Okay, so I have it on my phone right now. I won't be able to share it on screen as I'm on
Le-
the laptop, but I'll go with the first question.
okay,
Uh,
all right,
on the
I'm
back
sharing
end,
it.
you can just share that.
Go ahead. Yes.
Okay, so the first question is, what should be the step when you pick a case? So when a case is presented on the portal, or for now on the WhatsApp, as soon as we go live, you'll get it on the portal. So when you get it on the portal, the first step would be to call the attender, confirm the information. Any added information should be updated. That would be the SpO2 level, the preference of hospital. Uh, it can be the attender has updated a new alternate number, etc. You can make a note of it. And the most important thing would be what doctors have advised. Maybe it would be a next level bed. It might be a HDU bed, ICU bed, or an ICU bed with ventilator. Also, find out if the patient is at a hospital presently. Please do note the area the patient is present in, because the 108 or 1912, the BBMP executives will always allot a bed that is closer to that present location. Can we move on to the second question? The second question will be, suppose the attender's mobile is not reachable, what do you do? Now, in this case, you can keep the patient's details on hold till you can drop a text on that number saying you're from the Rotary War Room, and you are helping with bed allotment for the case. And I would like to repeat a very like to let you know a very important disclaimer is, in no way are we guaranteeing the patient a bed. Okay, all the beds would be allotted by the BBMP, or just in case any of our senior people on the war room have a connect with private beds, then we can help that way. So you can take this attender's mobile number, send them a message just in case their phones come on and they get in reach with you. You will go back to the first case, update everything, and then move forward. Any doubts, please do note. We'll take it at the end of the session. The question number three will be, what if SRF number or ID is not available? So if the SRF ID is not available, but the BU number is available, we can put it through. But if the SRF ID is not available, please do call the uh, attender. If the attender is not aware of what an SRF ID is, please do give them the information that as soon as they do a RT-PCR test, the first unique ID they will get is a BU number. Only if the patient has been tested positive is only when they get a BU number. Okay, so the next question is, what if BU number is not available? So then you can reach out to any of our people in the war room, the core team members. There is a link from BBMP where you can type in the SRF ID followed by a captcha, and After that, you will, as you scroll down, you will find the report details of the patient that you have picked. Now, if the capture doesn't work and it says incorrect, please be patient. Put it, enter the details again, because sometimes the server has an issue because of the overload of users. Uh, and if it doesn't say the captcha is incorrect, just scroll down and you will find the report there. It will show details of where it has been taken, the patient's details, and if the report was positive or negative. What if SRF and BU number are not available? So in case the SRF ID and BU number are not available, uh, there are various situations with this question. It can be, the first thing is, it can be the patient has not got an RT-PCR test. So you please suggest them to take an RT-PCR test. Or if the patient has taken an RT-PCR test but doesn't know any information, so at that time they will have to contact the lab, and the lab will help them further. In case they have not done it in a lab, they can contact the nearest UPHC center, and the PHC center will help them with the needed information. Next question is question number 6. What is significance of SpO2? SpO2 is the saturation level of the patient, the oxygen levels of the patient. Now, the patient will have different variations in this oxygen level. We will have to make notes if it is on the portal, and if it is on the WhatsApp, we'll have to mention what we have, the information we have received from the attender, as sometimes it tends to vary, and when it's varying, they will need different types of care from the hospital. So sometimes if it's low, they'll need a say if it's around 75, they will need a ICU, and depends if the doctor has suggested an ICU with ventilator. Maybe if the patient is stabilizing and is showing a little improvement, the doctors sometimes they suggest a HDU or a ICU bed. And if the patient has good saturation levels, that is 90 plus, they normally suggest an oxygen bed, 85 to 90 oxygen bed, so we can help get the patient stable until the doctor suggests further steps that should be taken. The next question is, what role does comorbidities play in that case? So this can be issues with maybe the patient has medical history, diabetic, BP, has liver problem, or kidney uh, uh, has been, there's kidney issues, or they are on dialysis, or they have cancer, or different kinds of disorders, or issues, medical health issues, that should be taken to be considered and should be mentioned in importance, because then it helps even the BBMP nodal officers or present doctors working there help assess the case and move it with priority. Also note, when we have all this information, it makes it easier to process this information, because then the BBMP takes this case as a valid case, and will not be sent to a verification team to follow up and verify if this data was correct. The next question is, how do you know to which zone the patient belongs to? So there are 8 zones in Bangalore. Uh, the 8 zones have different wards in them. Normally, you can use Google to find it. If you don't get Google, one of our core members can share a sheet with you, noting the various zones. You can also find lots of websites on the internet that show all those zones in Bangalore. And in case it's difficult for you to find it, just call 1912, inform them about what is the information you have. If you have a pin code, it makes it very easy for them to find out which zone the patient belongs to. Next question is 9. If a patient is admitted to a hospital, how do you choose the zone, residential address, or Krishnarjan, this is incomplete question, or hospital address? Okay.
Correct.
So then this question would be, if the patient is admitted in hospital, you can Google the hospital, or you can ask the hospital, the attender, as per where this hospital is located. So when you're logging it in with 1912, they put it under a specific zone, which makes it easier, since if the patients are critical and need to be transported by ambulances and all, to save the time between the transit, so we don't end up sending. So always make sure the house address can be anywhere in Bangalore, because the patient might have gotten that bed through a private source, or maybe they would have walked in, or they'll be at an emergency room, because with the panic, people are all around Bangalore trying to get a bed for their uh, loved ones, which is completely understandable. So please do note the location and the name of the hospital that they are in, and make sure, sometimes the executives on BBMP must be in a hurry or stressed or something. They don't take all the information. Always make sure you give the person on the other end of the call all the information you have. Even if they say, no, we've taken your information, someone will reach out to you. Tell them, please, we are from the Rotary War Room, and we would like to give you the verified information. The next question will be, how will you determine whether the patient needs normal bed, oxygen bed, HDU bed, ICU bed, or ICU bed with ventilator? Now, through our experience, it has been different with different cases depending on severity. Normal bed would be 95 and above, or 90 and above. These kind of beds will be it's the patient can actually, normally the patients prefer to go to the hospital and stay, as they are scared to infect the rest of their family at home. Sometimes if the whole family is infected, we have counselors who can speak to them, keep them on a very positive mindset, so they have the self confidence to recover at home, because they get better care at home than at a normal bed in the hospital, because most of the hospitals are short on staff, and at home they can drink hot water and hot food, and they have someone there who can constantly give them care. Now, oxygen bed will be for people who are having breathlessness and a difficulty of breathing. They need support from the hospital. If they do not have oxygen support or at home, is when we ask them to go to a hospital and get an oxygen bed. HDU bed, high dependency unit, will be a bed with oxygen and extra care. Some of the HDU beds come equipped with a BiPAP machine, so it helps support the patient. The ICU bed will come with, so the HDU bed depends on the saturation levels and the guidance given by the doctors. ICU beds also are with lower saturation levels, and depending on the guidance level from the doctors. Uh, HDU beds are comparatively easier, since we have a bigger number. ICU beds are for critical patients. It's an intense critical unit. The ICU with ventilator would be patients who need added care, constant care, with life support. So these will be our most critical patients, and it's very hard. So when you have an aged person with a low SpO2 level, please follow up with the zonal officers, follow up with the nodal officers at the zones, and make sure these people get the care they need. Sometimes we might need to be persistent and follow up a couple of more times until we get a bed allotted for the patient, and have them to help them survive this. So the next question would be, for which case would you call 1912? I suggest you call 1912 for all cases, even if you called 108. 108 only takes HDU, ICU, or ICU with ventilator cases. But 1912 helps you with all cases. The best part about 1912 is they transfer you to the zone, and at the zone, if you don't get the needed information, or if you're not confident with the clarity that the person who is on the other end, who is spoken to you, can always ask them to give it to their higher up, their doctor present there, or their supervisor, and then you can give them the information and ask them to allot a bed as soon as possible. For which case would you call 108? I've answered this in the previous question. Always call 108 for any emergency case with regard to a HDU bed, an ICU bed, or an ICU bed with ventilator. When would you call the zonal officer? When you haven't received a call, when the attender hasn't received a call for maybe more than 8 hours or 12 hours, depending on the criticality. And every critical patient, please do call the zonal officer, as they will share a WhatsApp number. You can share the WhatsApp number with the attender, and the attender can send all the information that is with regard to the reports that they have taken. It can be the blood scan or their CT scan or lung X-ray. All that can be sent to the zonal officer with the SRF ID. So then you can keep tracking it with the zonal officer. It makes it easier. If they don't pick up the calls, they will always reply on the WhatsApp. Next question would be, what is the way to get connected to the zone? So we have a list of numbers that we can call the zones directly, or we can get transferred through 1912. Next question would be, what is SARI case? So SARI case, like all the BBMP executives refer to it as SARI case, but the full form of SARI case is severe uh, severe acute respiratory infection. So this infection, what happens is, you can go, if the patient has got a RT-PCR test, it will come negative, but the CT scan would show uh, positive. It would show an infection in the lungs, or an X-ray also would show that. So these kind of patients don't get a BU number. So we need to call the zonal representatives and update them, or we can also take the reports, go to a local PHC center and ask them to generate a BU number. This case is a little tricky, as the patients can develop infection severely. Sometimes it depends on the patient. Suddenly, sometimes it escalates quickly. Sometimes you can keep them stable for some time, but then it is still developing in the lungs. So they need care as soon as possible, and they need a BU number generated. So this is about SARI case. It's tricky, but they do need the care. And the only way we can get this through is through the zonal officers or the zonal doctors, and by updating constant updates about the patient to them, to the officials. The next question is, what is the significance of CT scores? So the CORADs, I'm not well aware of the full form of CORADs. I think the doctor would help us with it, but I'll give you information. There are 5 levels of CORADs depending on the scores. So the first and second, it might show an infection, or it sometimes is normal for different patients. But then it starts from the third stage, fourth stage, and fifth stage. The fifth stage being the most extreme. Fourth stage would be moderate, and the third stage would be mild. These three infections are to be, all these scores are to be taken and updated to the zonal officers, and it helps them assess the case and take it forward. So with critical patients, we always go in for an ICU bed with ventilator, because the patient might have to undergo surgery if there's a lot of infection of black fungus that has been accumulated in the lungs. The next question would be, how to differentiate the scores with respect to how severe the case is. I just answered that question too. So there are 5 stages, and the third, fourth, and fifth stage need to be handled with care, especially the fourth and fifth stage, as it will make it easier for us to get the care needed for the patient at the earliest possible.
Vivian, on that note, I just got a request from Belgaum saying they are in one of them is infected by the black fungus, and what is the way to go about, and how can they receive the required medication and support?
That, as per my knowledge, is the doctors are the best ones to suggest, and the experience that we've had with the third, fourth, and fifth cases, the patient is normally monitored, and the doctors assess on how quick the fungus is growing, or how quick the infection is growing. They have medication to help support, and nebulization is one of them. Nebulization and steam helps melt the fungus, as per what I have been told by a doctor named Sam. And in case it is very severe, they do operate it. There's an immediate operation done, but it's always what do you say, examined by an ENT specialist and other specialist doctors. And in case it has become serious, they do tend to have an emergency operation emergency surgery performed on the severe patient.
All right. So this CT scores again was uh, how do you distinguish which is more severe out of 25 when you have, is 22 more severe, 5 more severe? That is a confusion that people get into. Just
Okay.
explain that once more.
0 to 10, doctors can suggest nebulization, steam, and medicines to help. That'll have two antibiotics. Sometimes it'll have two boosts also. So these help stabilize the patient and help cure at the earliest. The above 10, everything has to be monitored regularly, as it might infect, it might spread faster, or it might accumulate faster. But anything above 15 should be monitored closely. Like 10 to 15 can be, it also has to be monitored, but can be cured quicker. But 15 to 25, the doctors said always take it as severe as possible, because it's an unpredictable situation. Only the doctors can assess it. So I'm not a doctor. I would not want to make a comment on it. Thank you.
All right. So I think how to differentiate the scores again was covered in this, correct?
Yes.
Okay. Let's go to
What?
question number
Yeah.
18. Thomas sir wanted to say something. No, I think we can continue. All right.
Okay. What would you suggest the patient or the attender if you find them panicky? Okay. So, as per what I do and what I suggest to them is, I normally speak to them very positively, tell them 80% is your self confidence and 20% is what medicine can help you cure through it. Tell them the doctors are doing their best, but we need to be happy. We shouldn't be panicked by the situation. Please go about your daily chores, but stay isolated at home. Do take a lot of rest, sleep, but do make sure to move around home. Drink lots of hot water, eat lots of hot food. I normally suggest, like, I tell them to watch a lot of funny videos, and just in case, I would send prone videos for to the patient, just to keep them confident, and tell them if it's fluctuating and you've still not got a bed and you are slightly getting to panic, just give me a call. So what I do is I put them onto a counselor who counsels them, brings that confidence back up. Normally I have a very fun conversation with them, follow up with them, maybe once in a day or twice in a day. Ask them if I can have food arranged to come home for the period that they are going to be infected by this virus. And I tell them nothing to worry. You'll be totally fine. I give them examples of my own family members or my friends who have gone through it, and how
Just a
self
second.
confidence has kept them up and kept them positive. And it's basically, they need to be positive. They need to be positive in their mind until they get negative on their report. That's what I tell them. So sometimes patients do take that positive word a little harsh, but you can always say self confidence and use other strong words that builds will morality.
Sure. So what step we'll take if the bed is still not allocated or allotted?
So if the bed is still not allocated, we call the nodal officers regularly. We also update them saying that they haven't got a bed yet, and update them about the current situation. Now, this is very important. You cannot give the same information you gave earlier, because the case is going to lie in the same position. So you always have to update the current vitals and the current situation if the patient's health is deteriorating, excuse me. And if the bed is still not allotted, then you can also suggest to the attender to visit one of their local UPHCs, which has been effective from the past 2 days. So the head doctors there tend to call and also help get a bed allotted.
All right. So in what span of time would you make a follow-up call?
Depending on the severity of the patient. If the patient is not severe, patient is stable, just needs an oxygen bed, sometimes it takes 8 to 16 hours to get a call back. Sometimes it takes 2 days. But in the recent past, we've been seeing that there's a quicker response from BBMP. But if it is a severe case, we follow up once in 4 hours. Sometimes if it's very severe, like if the patient's deteriorating and they don't even have a oxygen bed, or they don't even have a they don't have any bed allotted. So what we suggest, go to the emergency room until the bed is allotted, and then we back to back give calls to the nodal officer and keep escalating this case as we tell them. They are at an emergency room at the moment, but they need an ICU or HDU or whatever bed that has been suggested by the doctor as soon as possible. Considering the age, we normally take youngsters on priority if it's deteriorating, and also senior citizens.
Okay. And what if the attender requests for medicines? What do you tell
We
them?
do not prescribe any medicines, as you are not a doctor. You can from our Rotary 3190 War Room website, you can, there are doctors numbers there, or if you have a family doctor who can prescribe medicines, please do share you can get them to call the attender and prescribe the medicines. In no way, please do not encourage telling them get any medicines. Like, even if you're sure about it, even if you have gone through it and you have got those medicines, to be safe, please do ask them to consult a doctor or anyone in the medical field to get to know what medicines they have to take.
All right. What if the patient requests for plasma?
What if the patient requests for plasma? So then you can share it with our war room group. There's a particular format that has to be filled. We will have the plasma given to the patients as early as possible, depending on the availability of the attender. Uh, but as we have been seeing, at least 20 to 30 cases, our Rotarian Pallavi has been doing an outstanding job with her team getting plasma. So if there's a plasma request, put it on the war room group or get in touch with any of us, and we'll move it forward, and we'll try our best to get the plasma as early as possible.
All right. What if the patient is allotted the bed and denied at the hospital?
So then these have been happening a lot recently, but it has been reduced. So what they have to do is call the nodal officer, mention that this particular hospital is not allotting the bed. Sometimes the hospital might not allot the bed if it has exceeded 4 hours. It is written in that message. But as soon as you let the nodal officer know, normally in about an hour or two, they give you another bed allotment. But during this time, please do ask the attender to go and file a case at the nearest police station with taking all precautions. But this is also needed. The attender can send anyone with the proof of the message. This will also escalate the case. But then 1912 and the zones are the best, and they will help reallocate a bed in times of these distressed situations.
All right. What if the attender is requesting for oxygen support?
What if the attender is requesting for oxygen support? Always we can, there are a few contacts on our Rotary webpage that you can look into, or you can reach out to one of us and we can support you with the oxygen. Otherwise, if the patient is critical, please ask them to go to the closest emergency room, preferably mid-size hospitals or small-size hospitals, as they will have some availability and will provide oxygen for a certain amount of time.
All right. What if the attender requests for cremation help?
Cremation help, you can call 14410, or you can call 104. You can also reach out to us. We can help you out with it. There also cremation
Krishna,
numbers
Yeah, I
put
think
on our.
actually,
Karthik would
yeah,
want to take this question.
yeah,
Karthik.
cremation help is not 104 wave. There is a new number that is given by BBMP, and that's the
Okay.
only number that is going to help for cremation.
Okay.
So we will list that with you, and you have to get a token number to actually get there. I will post. I think I have that poster somewhere. I recently had to use it also. And there are new cremation grounds created in Anekal, Tavarekere, Pidri, Kuppe, and Giddanahalli around Bangalore. And situation is not so good with the crematoriums. There is a long wait queue. And BBMP has made a number called 8495998495. And that is the only number. You got to go give the patient's Aadhaar card number, and online they will generate a token for you. And
Please
only
repeat that number, no?
yeah, I'm just typing it in the chat also.
Yeah, perfect.
I'll do that. So this is the only number for cremation, and you will get a token, and it says you should give an indicative time. You should help. You should tell the whoever calls you that they give an indicative time. And unfortunately, if you don't go within that indicated time, that slot will be given off. And also, maybe at some crematoriums there is a wait queue of somewhere around 30 minutes to about 2 to 3 hours, and you have to tell them to be a little patient, and also instruct them maybe to wear double masks and get their own PPE kit and go, and be very careful. Sorry, I'm talking out of live experience because I was at a crematorium 3 days
Please.
ago. I'm in isolation now. So.
Please, we want to
thank
give
you.
out the right information.
Yeah.
Thank you so much.
So, no, I'm
No,
telling
it's-
you. So, one of my younger cousin brothers passed away on Friday. So, and
So sorry.
the situation is not so good. I think you might have to give them some positive, like Viv was telling, give them some positive information and tell them to. I know we are sorry for the loss of your near and dear ones, and this is the information. And I know not many people can, take that. It's quite a difficult piece to do. And actually, that's the only thing. So now a lot of people come, no, I will go directly, and please let them know that they cannot go directly to any crematorium because the gates are closed, and only if you give this particular number, they will allow you inside. So I think that's one of the things for cremation. One of the most important things. Yeah.
Thanks for sharing that, Karthik.
Now,
I know
Karthik,
it's not easy.
this cremation number, you said you have to go as per protocol. Is it only for
Yes, sir.
COVID patients? Karthik, Shashi here.
No, sir. Yeah. So I dealt with a non-COVID patient also. So, but unfortunately now what has happened is, sir, is COVID or non-COVID, they will give you separate tokens. So I will give you an example of the crematorium in Chamarajpet, our TR mill. That is designated as both for Hindus, as COVID and as non-COVID. So they will give you there are separate gates for COVID and separate gate for non-COVID. So in the same way, Wilson Garden has been earmarked as COVID only crematorium. So non-COVID cases, electric cannot be done there. So if someone is looking at electric crematorium, Banshankari temporarily is closed. Wilson Garden is COVID only, and 3 new are created, sir. One in Anekal, Gidanhalli, one in Tavarekere, and one in Bidriguppe. So it's a long journey. Yes, perfect. This is Antima Yatra. This is the one. But yeah, I mean, those 3 are far, and I can give you another piece of it.
ಕಾರ್ತಿಕ್ ಇವಾಗ ಹೇಳಿದ್ಯಲ್ಲಪ್ಪ ನೀನು ಅದು ಯಾವ್ಯಾವ್ದು ಎಲ್ಲೆಲ್ಲಿ ಅಂತ ಅಂದ್ಬಿಟ್ಟು ಅದೊಂದು ಸ್ವಲ್ಪ ಶೇರ್ ಮಾಡಮ್ಮ ಎಲ್ಲರಿಗೂ ಕ್ಲೀನ್ ಆಗಿ.
I'll do that, sir. I'll get it shared on the group. It is newly come today.
Okay.
And one more update is that now there are, since the electric burners are conked up, we have somehow some of my friends had raised for one gas burner, and now the new system is that they are going to have LPG gas burners to burn the body to make it little more friendly to the environment. So that's a new update. But yeah, this is not to share outside. I'm telling this to the group because that's the new norm. And as regards the Christian cemetery is concerned, again, you will have to specify there on the call that, whether you want to burn the body, or for example, there is this Catholic cemetery. One of my friends had recently visited here on Hosur Road. So you got to specify. So they will ask you for what you want to do, and whether it's for Hindu, it's for Muslim, it's for Christian, and how you want to go about it. And then they give you a choice. In the operator gives you a choice of which place you want to go and how you want to do it. So maybe that's a useful piece of information for them to tell, because if anyone asks that, how do I go about this?
Thanks, Karthik. We'll take additional questions on this. We'll probably have a separate session on this. A lot of questions we totally understand. We would like to complete this, and we have a doctor on standby.
You can just put it on the chat. That's
yes.
You can
please go ahead and put it on the chat. Thanks, Karthik. We know it's not easy for you to share that, but you shared it for everyone's benefit. Thank you for doing that. The next question is, how do you go about grief counseling? Vivian, if you don't mind, I'll take that. Vivian, are you there?
Yes, please go ahead.
Okay, all right. So, folks, we have a counseling unit who is well trained. We've done more than 4 or 5 training programs for them, so they're up to speed to handle any sort of cases. Counseling is something that is not widely accepted in India, but it's the need of the hour. So, counseling cannot be imposed on someone. So we can just notify people that something like this is available. Someone is going through grief, someone is going through panic, someone is going through pain. You just tell them, why don't you take this counseling session? It would help. This is available free of cost for you, and they have to make that decision. And if they say yes, our team is ready to counsel them based on their time and language preferences. So that's how you're supposed to do it. And especially with respect to grief counseling, if someone dies in their family, just an hour or 2 hours ago, they have passed away, we can't immediately say, why don't you go for counseling? We have to give them that space. We have to let them know that something like this is available, but only when you're ready to take it, we will give it to you. We'll schedule a counseling session for you once you're ready for it. So this is how you're supposed to handle grief counseling or any counseling session for that matter. Okay, so the next question is, what suggestions you would give if the patient wants to move to a higher ward at the same hospital? Vivian?
Yes. So if a patient wants to go to a higher ward in the same hospital, it is the same procedure through BBMP. We will have to call 1912 and 108 and have this filled in. If it's for HDU, ICU, or ventilator, we'll have to call 108. The BBMP executives do put it through with the same hospital or any hospital close by. You can also personally ask the attender to request to the nodal officer, depending on the criticality of the patient. Most critical patients cannot be moved from the hospital, and the doctor suggests that you uh, get a bed here only. And in case the patient is financially well supported, then they can, if there's a private bed in that same hospital that accommodates COVID patients, they can always go for it.
All right. The next one is, what would be your answer if the patient complains that the hospital is asking money, though it was allotted by BBMP?
They will have to take it up with the nodal officer or any of the every hospital will have a designated BBMP official, okay, or they will have the number that they can share. If it still needs to be escalated, they can get the needed proof and go to the closest police station and have it a complaint registered.
All right. So the last question again, what would the volunteers seek if stressed out with handling the cases? I'm pretty sure the counseling is not extended only for patients or their family. Volunteers are our family. We are trying to do this service at these testing times. So we have already arranged a few sessions for our volunteers, and anytime an individual volunteer is going through a particular case, might have created panic in the volunteer as well. So we are here to mentally strengthen you and support you emotionally. We need your support for a long time to come, and we have to make sure that we don't burn out with a lot of work that you're doing or the kind of cases that you're handling. You might be handling a lot of critical cases, so please be mentally strong, and we are here to support you. Okay, so Vivian, thank you so much for answering all these questions beautifully in such a short
Thank you.
time. So if you have any additional questions, you can list them down on the comment section. We'll come back to that. Now, ladies and gentlemen, it's time for us to listen to our young doctor, uh, a holistic health healer, currently who's practicing telemedicine, a trained yoga teacher and energy healer. Uh, Introducing to you Dr. Akshata Kulkarni. Akshata, over to you.
Yes, hi Krishna, thank you so much. Firstly, congratulations to each one of you for volunteering for this COVID war room and being there for one another. This just shows that humanity still exists in our society, and just looking at everybody participating so enthusiastically, it just gives it's making me very overwhelmed at the moment right now. But I have one of my relative who is constantly calling me, so I'll just take up a very few questions. The ones that I noticed on the Vivian's presentation as well, as to what CORADs were. CORADs basically, they are categorical assessments that we do. So they are nothing but COVID radiological assessments. So this we understand only to represent the level of suspicion in the sense like we want to know what is the lung involvement. For that, we do something called as a CORAD study. So this again, like he already mentioned, there are 5 levels in it. He's already mentioned it beautifully. What I would like to tell here is that the lungs, right, the right and the left lung, they have total 5 lobes. So that is the right lung has 3 lobes and left lung has 2 lobes. So with this, I know it's a lot of medicine right now, but then just bear with me. So with that, we give a scoring to each lobe. And with that scoring, we come to a total assessment. So if anything above 9, then we consider them to be in moderate to severe infection, and then immediate admission is required for the same. So that was one thing that I really wanted to tell. I am so sorry I'm in a hurry right now because I really have one of my relative is happening to call me a lot. Is there anything specific that you guys want to know?
We'll just take a couple of questions. Anyone
Yeah.
has any questions, you can just type it out on the chat section.
Yes, that would be
Or
good. That would
yeah,
be
or
good.
raise your hand. Thomas, Vivian, any questions you've had with respect to medical technicalities that you would want clarification?
Nothing from my end, Krishna.
All right, thanks, Thomas. Thomas, sir.
Also,
Vivian?
Krishna.
Yeah, Akshita.
Yeah, about the plasma therapy, right?
Yes.
So the plasma therapy has been, right now the trials have been found that it has no significant benefit. So first we used to use that at stage 3 when the patients are undergoing a cytokine storm, and then their oxygen saturations are depleting. We would use plasma therapy, but right now that is just yesterday ICMR has disapproved the usage of plasma, and it has actually taken off from the labels. So that's just one thing that there are people who still use it, but that has been like specifically taken off from the guidelines, but it needs a little time to be implemented as well.
All right, thank you, Akshita. We have one question from Tarun.
Sure.
Yeah, Tarun, go ahead.
Yes. Hi, Dr. Akshita. Mainly, I wanted to know about the CT score because many people are freaking out for the, just as you told, from 9 it's considered as acute, but then many people are freaking out when their CT score is 15. So
Yeah,
would you
so
like to guide on that as well?
yes. So there's one thing we have to observe here in the CT score: how much less you have, that is 1, 2, 3, that severity of infection is less. Okay, and as it increases, as the CT score increases, your severity of infection also increases. That is what you have to understand. So the severity from 9 means that your lungs have been moderately infected with this COVID-19, and it might go into the disease might progress. So we want to stop this progression of the disease. So anything above 9 is taken to be severe. Because at this current situation, if they do not maintain their oxygen saturation, then anything above 9, we consider it to be moderately severe. Did that answer your question, Tarun?
Yeah, that's totally relatable. Thank you so much.
That's okay.
All right, we have one more question from Protractor Amog.
Yes.
That's on, can you give some info about 2DG and how it works?
So basically, this is nothing but 2-deoxy glucose that we are using right now, which has come because of DRDO. And this is nothing but, sometimes it's a glucose molecule. Okay, so we have this liver that causes something called as glycolysis. Okay, so there is the liver which is producing something. There are a lot of significant terms there, but instead of getting into it, it is basically something that will take the glucose from your cells, and it'll increase the uptake of glucose by increasing your immunity. So it is basically used as a tumor therapeutic drug, but right now, because it has seen so much of Today we saw that it has saved almost one patient from oxygen saturation of 35 to 40%. So the person who had 30 to 40% oxygen saturation, it has actually brought him back to life. This is nothing but because it is increasing the uptake of glucose and helping the body sustain the metabolism. So once it starts to sustain the metabolism and the body is ready to fight the infection, that's when your treatments are also responding well. The body is responding to the treatment that you're getting. So this acts as a glucose uptake molecule. Does that help you, Amok?
Yeah, totally. I just had a continuation like question. So is it going to replace remdesivir or will it be taken in parallel to remdesivir?
Yeah, so basically once we find more patients who are responding to this 2DG, that's when we'll be able to replace it with remdesivir, because we cannot leave remdesivir because it is reducing the infection right now. So at least the severity of our infection is coming under control because of remdesivir. But once we see more patients recovering from 2DG, yes, it will have to replace remdesivir.
So just going on the previous question of that CT score, say, I mean, because our volunteers are here, what is the best way to tell it to a patient that not to panic, right? What are the terms that you would suggest for the volunteers, to use? Because I know 15, a lot of the times we see messages with 15, 16 also. So what's the term maybe we should use, or how do you pacify the patient's attendant?
Yeah. So right now you tell them that, that the patient does require immediate admission, but because you're doing whatever you're able to do, right? You're able to attend to them and get them a bed and everything. So until then, just tell them that they could do, if at all the patient is undergoing hyperventilation, or if there is any breathlessness, ask them to prone the patient and wait. Perfect. So even though the CT score is high, ask them to prone the patient and wait until they can arrange for a bed.
Perfect.
Okay, and then once they reach the hospital, the required care will be taken, obviously. So until then, just watch for any oxygen saturation levels dipping, or prone the patient if at all that is happening.
Good. Thanks. That's a good suggestion. People can note.
Yeah.
All right. One last question, Dr. Akshita.
Yes.
Jayashree ma'am, please go ahead.
Yeah. Hi, doctor. One question I had is that even remdesivir was supposed to have been taken off the list of protocol. I heard so. Is that so, doctor?
Yes. So again, we were waiting for this 2DG to come out, and then remdesivir would be taken out if at all the infection would be controlled. We were giving. Oh shit.
Yeah.
Hello. 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 Krishna, am I audible?
You're audible, ma'am. You can go ahead, please.
Oh, sorry. Yeah. So remdesivir was supposed to be taken off the medications until the patients responded well to other antiviral drugs.
Right.
So because none of that happened, and it proved to be one of the major drugs that people were responding to, and especially our Asian race was responding to, we still have remdesivir in our guidelines. So once 2DG happens to prove its sustainability, that's when we can take it off completely.
Thank you.
Yeah.
Perfect. Thank you, Dr. Akshita. I think those were the questions we had for you for now.
Exactly.
We'd love to have you back very soon on one of
Definitely.
our future sessions. We know you're in a hurry. So she's also part of our counseling group, and that's where we had this beautiful find. Thank you, doctor. She's also on her way to become a trained professional in counseling as well, and she felt our counseling initiative, Rotary Listens to You, is helping her a lot in interacting with the patients and getting the best out of them.
Yes.
Doctor?
I wish I could have given more, but then I am getting repeated calls. I'm so sorry about that.
No worries, Dr. Akshita.
Yeah.
This was very useful for us. We'll get you back very soon.
Definitely. Thank you so much.
Thank you, Doc. Thank you.
Thank you so much. All right. So we have a form in the chat section. and we request you to take the test tonight or maximum by early morning tomorrow. The lines will be closed by Abhi. Can we close it by 11 a.m. or would you
12
want to
to
do it?
12
12 noon.
afternoon.
12 noon. Okay. So we'll just also just take you through the portal once, just to show you how it looks. And the process would be we'll have in the war rooms, we'll have data entry teams who will work on collating the data onto this portal, and we'll have other set of volunteers who will own these cases and talk to attenders, get the optimize data, and then get in touch with BBMP, all the things that you learned just now, utilize all that knowledge and make those right decisions, get the right channels to get in touch with BBMP or the zonal officers, nodal officers, and then get the help at the earliest. Okay, so the cases get listed like this on the portal, and the volunteers as well as the admins will have access. We'll also have dashboards which will help us understand how many cases are coming in. Okay, so a new case has to be entered. The process has been automated. It gets processed here. All the data that's come in, we see a lot of duplication happening. So to prevent duplicates, we have this section. SRFID generally is taken as a way to avoid duplicates. Hit on check for duplicates, and in case this case has already been registered, our data entry team is doing a fantastic job. So this case has already been registered. Okay, so once that is done, if all the data is accurate, it reflects in this section. And as a volunteer who's working on this case, you can just click on this and assign the case to yourself. If you're working on it on the WhatsApp group, you can say, I'm going to work on this particular case. Every step that you take on this particular case gets documented, and you, as an admin, you can, or an individual volunteer, you can assign the status of the case. Pending is when the action is pending. Registered when you've registered the case with BBMP. Assigned when you're working on it. Admitted when the patient gets a bed in the hospital. Discharged when the patient is cured and is coming out of the hospital. And expired in case the patient is no more. And other cases, other statuses can also be used with the relevant comment. And this is the comment section. So you can also hit on the WhatsApp button, and you'll be able to send the data on WhatsApp for that particular case. In case specific action is required outside the portal, that is one way of doing it. And admins will have the access to also assign, apart from people owning the case themselves. We can also transfer ownership as well as assign it to volunteers who have registered. And in case the data on the thing is invalid or incorrect, we can also delete the case. So as of now, we're trying to process every case that's coming through on the WhatsApp groups. So the war room, as you know, has been extremely effective over the days. We'll also have a dashboard on how many people are sending requests to us, how many actions have been taken, how many volunteers, how many patients, how many, what are the different statuses the cases are in, daily count, if all the cases have been put in, how many volunteers split admin and volunteer, and individuals, how many cases they're owning. So all this will be live from tomorrow. So we would give this access to volunteers after you go through the exam and you come out with flying colors. So this is a way to prevent duplication and also prevent or ensure data security. And we also will have a track of all the cases, and follow-ups can be done meticulously. So this is the update from our end. Please do utilize the portals that we already have. I'm just checking if we have Kiran sir with us. Kiran sir hasn't joined. Abhi, just check if Kiran sir can join us. So if we have any other updates or anything else, so the War Room is an initiative from Rotary 3190. The Rotaractors, Rotarians, and Inner Wheel members are working together on this. Multiple sub-initiatives under the War Room have been taken, and under the leadership of our District Governor Nagendra Prasad sir, Rotarian Kiran, our International Service Director, who's also part of the War Room at the CM level. So CM War Room Initiative is also an advisor there. So we are in good hands. We are able to do a lot of things, and many other NGOs are also getting inspired by our work. So let's keep up the good work. And we have Vivian who would like to say something. Vivian?
Yeah, there's a question in the chat box by
Sure.
Pujita Yatiraj.
Okay,
So
let
the
me
question says, hello, once we raise a case with either 108 or 1912, how do we keep ourselves updated about what is happening with the bed allotment? Is the attender the only person who will know, or do we form the team? Do we
we from the
from the
team.
team have access to this data?
Yeah, go ahead, Vivian, answer that.
Okay. So when you do raise this, when it is 108, the attender or you will get a call from BBMP. So that's the only way we can trace it with 108. With 1912, we can have them transfer us to the zone, and then the zone can let us know if the information has come, has it been updated or allotted to any hospital, and they will be able to update us on what is the situation. Normally they'll ask you if you got a message or not. If you have a message, it will be there for 4 hours. The bed will be waiting for 4 hours. The only way you can track this is by calling 1912 and the zonal officers.
All right,
So from the
thanks, Vivian.
team,
Yeah.
one small thing from the team, from our portal, how you can track the cases. It will be regularly updated by whoever picks it up. So whoever picks it up will always put a note there with the current status or whatever update they have got from the attender. Thank you.
Perfect. So each and every step or progress on the case can be documented. As a volunteer or as an admin, you can just hit on that comment button and keep everyone posted on the progress. Okay, so that's about it. We'd like to thank Karthik for spearheading the initiative on behalf of Rotary District 3190, and the War Room has been doing well with all your support. We request you to support this initiative on a continuous basis, so that we'll be sustainable. We don't know when this is going to end, but we are all prepared to do and support whatever support is possible from our end. We'll extend that, and we're all ready for the wave 3 in case it comes. So Karthik, if you wanted
Yes.
to say more.
Thanks, Krishna. And I think Krishna, Abhinav, Vivian, Thomas, and Pallavi, and been doing a fantastic job. Day and night. They hardly sleep, and now DRR and DRR elect are here. And, both of them have doing a great job. I see all of you putting this together. I think we've all come together for a cause, and it's all united we stand, and united we fight, and we shall go over this. I know we have all faced some personal losses, and we might have faced the many things, but let's like we said, remember one thing I keep telling people. For the first time, we always say positive is a good word, but for the first time this pandemic has negated it. Positive is a bad word, so we don't want to hear the word positive when it comes to COVID. We want to hear the word negative. But otherwise, if it's the mindset, we want everyone to be in a positive mindset and not negate themselves, because you all handle different kind of cases. It might be a panic situation, it might be oxygen, it might be someone searching for a bed desperately, it might be someone looking for a crematorium slot, right? Just like Viv was telling, talk to them in an amazing tone, and give them that comfort, and show the light. I remember, being at the CM's war room in wave 1, and most of our Rotarians were there, and there was a lot of positive vibes. In the same way, like what Kiran sir says this year, uh, the term Rotary now with the BBMP war room and top officials, it's changed actually the way things are handled, and we're getting accolades all over, and all of you are the ambassadors to this. And thank you once again for volunteering your time and your efforts, and we shall pass this. And Krishna, great job. You're I know you all are the backbone, you, Abhinav and Vivian. Thanks once again for doing this, and back to you.
Thanks, Karthik. So we have Dr. Amoga Kamath as well with us, in charge doctor of BBMP West Zone War Room. So thank you, doctor, for joining us, and we will get in touch with you. We'll probably have a session with you tomorrow or day after. We are having regular sessions at 9:30 p.m. on a daily basis to share knowledge and best practices. So let's make sure that we're all up to speed and are able to help people at the earliest. One more special mention to our protractor Arun Teja for creating this beautiful website. I'm pretty sure most of you have seen it.
Sorry.
If not,
Sorry, I forgot to mention. Yeah, Arun Tej also did a fabulous job. Thanks.
Yes, so this is the website. You have resources that have been accumulated with this, which is the vendor portal, the helpline that we have, as well as the database, and some important documentation, phone numbers for home care, knowledge guides, useful videos. This prone video has saved a lot of lives, so keep that handy. And this is the portal that other portal that we are talking about with respect to vendor validation. So simple, you just click on the service that you would want, and you will have the respective contact number, and you'll also have a way to mark whether that was useful to you or not. Okay, so if you can see the 100 here, that means this number is probably working. The last update is also a way for you to get an understanding of whether the data is current or not. And here you see few numbers which are at 40 or 0. That means those numbers don't work. So every time it works for you, just click on worked. If it is not available, or if they don't have stock, they say no availability. They're not responding on call, no response. And if you feel it's not relevant at all, someone might say this is not ambulance service anymore, this is going to a restaurant. So in that case, we'll remove it. So these are the examples, very nicely designed again by Rotarian Arun Tangsali sir. You can see the COVID patient portal as well as this is pretty common. It's made by the same person and beautifully done. So with that, thank you, Rashmi Tangsali ma'am, if you're here with us. Thank you for getting it done.
And
Thank you. Thank you. Good luck to everyone.
Thanks, ma'am. Thank you for all the support and everything that you're doing. We really appreciate you and sir doing this.
Yeah, always with you,
everyone.
Karthik.
Thank you. I also, I think, recognize the presence of our district chair, Vince Rotarian Shashikant, who's also from Rotary Bangla Southwest. I think he's already submitted the form. Thank you, sir. Thank you for your proactive
participation. You're doing a fantastic job. Well done, my dear friend.
Thank you, sir. He also is the district advisor for our Polio Plus committee. I know you've been very proactive, and thank you once again, sir, for all the support.
I've already submitted my form, KK.
Yes, that's why. That's what I said. I mean, you are the first and most proactive to submit the form. Thank you.
Thank you, sir.
All right. With that, Raj, if you wanted to say any words, you can go ahead.
Nothing from my side, Krishna.
Sorry, and I forgot to mention, Raj has been now spearheading and doing a fabulous job on the food distribution. Thanks for that, Raj. Sorry, I forgot to acknowledge.
No problem, Karthik.
All right. So with that, we come to the end of today's session. Thank you so much, everyone, for joining in. We'll again circulate the forms with Raj as well. So on the war room groups as well as other channels that Raj would prefer to circulate this in, so that all the people who have attended today's program can the training or orientation can attempt this test. It's basically for people who are ready to spend some amount of time on a daily basis or on a weekly basis with regular commitment to help out in this cause. So if you are one among them, kindly come forward. We need your support, and let's try to help as many people as possible. So
Krishna, I think Arun is on the line. If anybody, I don't know. I think he's on the line.
Arun sir is here. Arun sir, are you with us? No, Arun was.
Okay.
No, he's not here.
Okay. Thanks.
Okay. Yeah. All right. Thank you. Thank you, everyone, again. And we'll see you tomorrow and on one more session of our next knowledge transfer session. Thank you so much.
When will we know that if where we are, our forum has been read, and will we get a communication, or how is it?
Correct. So you'll be added to a different group once you pass this test, sir. So
okay.
we kept 70% as the criteria. All the best to everyone. Do well. And it's mainly logic, and from what you've heard, you can also go through the YouTube video once more if you want, for better understanding of concepts. And
Krishna, and one last word, that if people, please look out for people who are inactive on the war room groups and report it to Abhinav for further action. If you feel someone is not active, some numbers there, please let us know, and we would want to take appropriate action. Thank you.
So it's basically for us to make sure all the volunteers are active, and there are many more people who would like to be a part of this. So let's not just be there and do nothing. Okay, so once again, a lot of appreciation flowing in for all of you. Thank you so much. Let's continue to do the good work. Thanks, everyone. That's it from the war room.
Good night, everyone.
Good night.